Hello, my name is Tosin Omolaja, and you're welcome to NAFDAC and your else, where we bring you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. Eradicating the menace of falsified, substandard, and unwholesome food, drugs, cosmetics, chemicals, and other regulated products is one fight NAFDAC is engaged with on a daily basis, round the clock. Under the watchful eyes of the entire workforce, led by Professor Mojisola Adeyeye, the agency has continued to stay steps ahead of counterfeiters and their ilk.
Because of our high alertness now as an agency, we are unraveling counterfeiters, and we are blacklisting them. We're going to be putting the list of blacklisted companies on our website so that the fear of God will be struck into the soul of people whose intention is nothing but to kill our people with bad medicines. Any Nigerian company, market authorization holder that is conniving with such companies will be delisted. Their products will be delisted. We have delisted few Nigerian companies already, and we'll be publishing them. The blacklisted companies will be published as an advertorial for everybody to see, because we have to keep at it as an agency to be one step ahead of those who are falsifying medicines, counterfeiting medicines.
To ensure that the measures put in place are both holistic and effective, especially with regards to medicines, the agency took the fight to the source.
The importance of having quality medicines on our shelves in Nigeria is premium to NAFDAC. We import about 70% of our drugs from Southeast Asia, mainly from India and China. And for the past 2 years, we have been devising many mechanisms to ensure that the quality of medicines that are brought into the country is very, very good. One of the things that we started doing about 18 months ago is enforcing our pre-shipment testing, making sure that the clean report and inspection analysts in India and China are brought to be highly sensitive to the quality of medicines that they pass for importation. NAFDAC went to China September of 2019, before the COVID. I went with about 8 members of our staff from Ports Inspection Directorate, from the labs. But before we left, the laboratory has already drawn up the criteria that we will be using to certify labs in those 2 countries. It was an exhaustive trip, but it has yielded great dividends to the benefit of the health of our own people. Any lab we visited that didn't meet our criteria, we strike that lab out. We had meetings in Shanghai, in China, and I believe in Hyderabad, in India, met with the CRIA agent, Clean Report Inspection Analyst, and let them know that 2 cannot work together unless they agree And China, India, working together with Nigeria as far as drugs and food are concerned, we have to agree. And the basis of the agreement is quality of those regulated products. Since that time, over 80 or over 70 different products, drug products, have been stopped from coming into the country, because the laboratories will now contact us almost on a daily basis that this product failed, that product failed, this product doesn't have the drug that is supposed to have, this tablet cannot dissolve. So we have stopped a lot of bad medicines from coming into the country.
On the home front, the agency has taken an even tougher stance on ensuring that standards are met and maintained across board.
Of course, to improve the quality of our medicines, we are now stricter with our local companies, not just the ones that are coming in, with our local companies. We test their products after approval. We're going to be using now risk-based sampling, meaning there are some products, irrespective of who made such products, that will be sampled. For example, if you have an eye solution, first it's a solution, it can degrade quickly, but because it's going onto a sensitive part of the body, all those will be sampled and tested. Drugs that are made by companies that have had history of violation of our rules, we will keep running after them and testing them. So we are using risk-based sampling, not just okay, you bring your samples when you are registering, and that's it. And then the company goes back and change the formulation on us. So it will be post-marketing risk-based sampling. We have approved it, but we are waiting for you to get to our market. We will start sampling in the market. So this is part of what we are doing to make sure that post-marketing, post-approval, the manufacturer doesn't change their formulation on us, and if they do, we'll catch them and delist them. We are going to launch very soon on-the-spot testing of drug products in the market, in the pharmacies, at the patent medicine stores. We just got approved by FEC for such testing devices, and this is part of making sure that the drug that is on the shelf being sold is of quality. The device that we are using is called TrueScan. It was used many years ago before I joined NAFDAC, and even at that point, it did a lot of work, but it was qualitative. Qualitative meaning it can identify counterfeiters or counterfeited products, meaning if it's labeled Panadol and it is aspirin, it can detect that it's not Panadol. But this new version of it is quantitative. It will show that it is the drug, and it will show the level of the drug.
There are also those who fake NAFDAC registration number or use registration numbers belonging to other products. The agency has also begun cracking down on such activities.
Let's just start with companies that register with us. A company registered 2 products. We gave 2 NAFDAC numbers. Same product, different flavors, but 2 NAFDAC numbers. The product was assumed to be failing in the market. It was so thick, it's a liquid product, it became so thick on the shelf. And we were called, of course we put a hold on it. We visited the company. 2 flavors became 5 flavors, using the 2 NAFDAC numbers that we gave them. This is a registered company or company that have registered products. That is one case. Another case is companies that don't even know anything about NAFDAC registration, that we just get NAFDAC number from any product they see in the market and use it. There was a case that a doctor called me about 3 months ago, and it's an antibiotic. And he said post-surgery infection that shouldn't be there was there despite the fact they were using antibiotics. And I said, could you send me the pictures of the packaging? They may not be registered. And behold, I think 2 out of 4 were not registered. The doctor was shocked. So I will advise healthcare workers to always check that it has NAFDAC number, and always keep receipts of where such were bought, so that we can use that in our own investigation to track down the source. We are mopping such products from the market right now, and it will be so difficult to know which the packaging, the genuine from the fake. This is part of what NAFDAC does and goes after, and that demands a lot of tools, a lot of vehicles, a lot of journeys to travel. Our job is not 9 to 5, because the job of keeping people alive is almost round the clock. But that is what NAFDAC does, and we will keep improving on this.
NAFDAC and your rails will be right back. Please stay tuned.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region, in this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on pending reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the watch list tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your wealth. All hands on deck right across the country as the agency intensifies its enforcement activities to make sure our markets are rid of these very dangerous products.
Even as I speak, there are a lot of operations that are in the works. So we are still working to see how, because we cannot, when our people are dying, they are killing our people, we cannot rest. So that is why we are using this to call upon the government. We need more support. We need all the support. We need all the support in terms of logistics to do this work.
This call for support from all stakeholders was exemplified in Port Harcourt, Rivers State, when the Honorable Commissioner of Water Resources and Rural Development, Dr. Tamuno Sisi Gogo Jaja, reached an agreement with NAFDAC, agreed to collaborate in weeding out quacks from the packaged water industry. Earlier, the agency had conducted raids in parts of the city of Port Harcourt, tip-off by concerned citizens about the products at Fimi Market, Aboloma. The NAFDAC team, accompanied by officers of the Rivers State Police Command, confiscated large quantities of unregistered Nourish Delight bread and donuts as they were being sold to the public. The team also raided a sachet water factory located at the Choba area of Port Harcourt. The factory was operating in a substandard facility with poor filtration equipment, altered production flow, how packaged water were being packed on bare floor. The company was also found to be producing with expired license and with the name of the sachet water as Resources Table Water instead of Nedu Table Water, which the company registered with NAFDAC and also with a fictitious registration number.
When your license is expired, before it expires, you come to us for renewal. You don't register and you run away. Because we have discovered for the most part that most of these people, what they do is after registration, they go their own way. They start doing whatever they want to do. They don't come back. But we have a way of getting them with the routine inspection you are talking about. Sometimes we have unscheduled inspection. We go, or when there is report. That is why we keep on calling people. Please report to us. Report to us what is happening in your neighborhood. Report to us. Report to us. We appeal to everybody. We appeal to the journalists. Some of the fantastic seizures we've had came as a result of investigative journalism, people giving us reports, members of the public telling us this is what is going on in our neighborhood and the rest, and we go after them. So the expired people who operate under expired licenses, there are consequences for that. We have the law which addresses it, and we deal with them.
In Asaba, Delta State, NAFDAC intercepted a Mercedes truck containing, amongst other drugs, improperly stored tetanus diphtheria vaccine, various unregistered, banned and controlled products, including analgin injection, artesunate injection, and so on. Some of the counterfeit products that have been cleared for destruction were recently destroyed in Abuja, and similar exercises have taken place in other regions of the country.
In Abuja, we want to also use this opportunity to commend the Nigerian Customs. We've been working with them. They turned in a truckload of chocolate. Bad, unwholesome chocolate, illegal chocolate and sweet. So it was handed over to us. We destroyed the products as well as some of the other items we had, which we seized. And the street value was 99.9 million naira. So you see, all this period you can see that we've not been resting enforcement, and we are carrying out more actions. We are going to be involved in destruction exercise. We'll be doing one in Kano, that's for the northwest. We are doing in Gombe. We are doing in Oka. The Oka will cover the south, south, and southeast. So you can see enforcement. There are a lot of activities going on, doing this, doing that, and even as I speak, there are a lot of operations that are in the works.
That's our package for today. Please join us, same time, same station, next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email, reforms@nafdac.gov.ng, or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. Taking the NAFDAC-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the MedSafety app from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.